Tom, I hope you can hear me. I promoted you to a panelist so that when they ask you to talk that you can.
I can hear you.
Great.
Can you hear me okay?
Yes, we can hear you fine. I just wanted you to know that you're over there. We don't normally leave people, but since I think you're the guest speaker, I was just going to go ahead and promote you from afar and leave you there. So
Great, thank you.
you're welcome.
Rebecca?
Hey, Buzz.
Hey. I wanted to know if you can promote me from afar.
I just did. I just did.
I need a promotion.
Right?
Oh, golly.
Oh,
Let's see here if we can make him look prettier. Ooh,
it did change your color.
it did, didn't it? There we go. Yeah.
How is everybody?
Absolutely marvelous, sir. How are you?
Good.
Tom, are you doing all right? Oh, he's muted. Josh, you need to move those antlers over a little. You need to either move over to your right or something there.
Yeah, make those antlers, Josh, where they're right above your head.
Yeah. He can't hear us yet. Oh, Amy. Josh, can you hear me?
I can hear you.
I knew you could. Josh, can you hear me?
I can.
Move over to your right about a foot.
Please, Josh,
No, your
Other
other
way.
right.
that way.
No, don't.
Let's,
Line your head up with those antlers. Little more,
there you
little
go.
more. There you go. Right there. Stay right there.
Can you hear me?
Yeah. Dusty, you're on top of the world.
Or fly me to the moon.
Amy, you got anything good for diverticulitis?
No.
Do you have that, Buzz?
Yeah, I got that. I suffer through that well, I'm lucky if I can make it a year without getting hit. I've been kind of down here the last, I don't know, 48 hours or so.
That's
I'm
pretty
on-
painful, isn't it?
I'm sorry.
Isn't that pretty painful?
Yeah, it is. Yeah, I've got some heavy duty antibiotics. I'm just thinking maybe Amy might have some elephant tranquilizer or something.
She got this one.
No, nothing magic. I actually don't do elephants.
No, you don't. You just haven't had the opportunity. That's the problem.
Okay. Just checking to see who we have with us. We'll be waiting for Commissioner Hayne, and Commissioner Callaway will not be joining us at this meeting today.
Is she doing all right?
He told me he was having a rough afternoon.
Uh-oh.
Looks like Jay may need to get moved over.
Yeah, can we move Jay over, Michael?
I think Commissioner Hayne is in the same boat. I don't know that he's on yet or not, but he's gonna have to be moved over here.
I cannot see Commissioner Hayne yet. I just moved Jay.
Okay,
Commissioner Hayne says he is on now.
Okay, let me look.
Well, sorry, folks, but somehow I just lost my video.
Is Commissioner Hayne just listed under a cell phone number? Because he is not listed as a name.
Can anybody hear me?
yes, we
Yeah,
can.
loud and clear.
Yes.
Okay, well, I've lost my video. I'm not sure how that happened, but yes, if I went back to the attached notice.
Rebecca, number 85 has his hand up. Top of the list.
That may be more.
Yes, he has his hand raised.
Okay, he's coming in as a panelist.
Okay, good.
He's not
There we
signed on
go.
the way he normally is. There you go.
Okay. All right, it's after 3 o'clock. Let me call this meeting to order and give you some background. The purpose of the meeting is to revisit and review the possibility of reinstating masking into the town requirements, dealing with the COVID situation. At our last meeting on Thursday night, we looked at this idea of where we were with COVID and masking and our sign requirements and so forth. We took no action. The next day, Tom Neal, the CEO of the Highlands Cashiers Hospital, and also the head of our vaccination initiative, contacted me and expressed the concern that he thought that it was time to look at the issue of wearing masks again, that what he was seeing was concerning to him. And I told him that we would call a special meeting today to discuss this and hear from Tom. So I'm going to turn this over to Tom and let him give you his briefing and information and what he would like to request of the board. So Tom, it's all yours.
Thank you. I appreciate the opportunity to speak, Mayor and the Town Council, as well as those that are participating. And when I reached out to the Mayor, I was very concerned, and I'll just share it. I won't get into much detail, but in brief, we are seeing a heavy increase in COVID in our community, but also along the region and much farther than that. And we're on average seeing probably 2 to 3 cases a day of COVID in the emergency department. To refresh the board's memory, we don't have an ICU and we don't have this ability to manage a COVID full time. So our responsibility is to stabilize and transfer this patient should they require hospitalization. And that's been our practice. We have had patients we have had to keep in our hospital for 12 to 24 hours looking for beds. That's a combination of hospitals are full, that they don't have capacity to care for patients. And candidly, that's often not due to lack of ICU beds or lack of ventilators. It's often due to lack of staffing, because this wave of Delta has also really heavily impacted the healthcare workforce. There are many staff that are getting exposed, that are being quarantined, or are in the hospital as well. So, it's very serious. We've had to transfer as far as Richmond, Virginia. It's not uncommon to send to South Carolina or further. I also reached out before I contacted the mayor, and I talked with our sister hospitals, talked with EMS, and talked with the health department. And they all, said, please speak on our behalf as well. And I'll have a letter from Warren Cave, and I just want to share this. I think he did a really nice job of summarizing how it's impacting EMS. And this is important because I can arrange for a patient to be stabilized. I can arrange for transport or transfer. I still need a helicopter and ambulance to get them there. And it's very difficult right now because EMS is also being very heavily impacted. So this is Warren's letter. He allowed me to share it with you. He said, Tom, per our previous discussions on the situation of healthcare within Macon County and the relation to the COVID crisis, here are a few areas of concern that I currently have. Staffing. EMS currently has 8 full-time vacancies out of our 41 full-time positions. We have a large roster of part-time and as-needed employees, and though the use of those staff members and liberal use of overtime funds, we, for the most part, have been able to maintain our existing levels of service through the month of August. Our staff is in contact almost daily with COVID patients, and inevitably we have staff that we need to isolate and miss work due to illness. We did experience a 4-hour period on August 16th when we had all of our administrative and supervisory staff on ambulances due to employee vacancies related to isolation and sickness when we had to drop an ambulance in Franklin. That left us 2 staffed ambulances in Franklin, 1 in Highlands, and 1 in Franklin with no supervisory backup to maintain our county coverage. We were able to get back to 4.5 ambulances by noon and return to full ambulance coverage of 5 staffed ambulances, but still with no supervisory backup by 4 that day. We did onboard regional transport, and for you on the call, regional transport is the Mission Health System that is here to help transfer patients between the different hospitals. So we did inform regional transport of our staffing issues, so they would be prepared for interfacility transport issues. We do not see our staffing issues improving for several months. The 911 center is just now returning to full staffing after having several openings during the summer, but we have no abundance of part-time or as needed there to cover any unexpected vacancies. 2, equipment. We maintain a fairly large inventory of spare ambulances in our fleet. For every frontline staffed ambulance, we also have a spare ambulance at the same ambulance base, mainly due to our large geographical area we serve to mitigate any unexpected equipment failures. We also maintain a fleet spare ambulance that rotated to each ambulance base as needed when one of the frontline, our spare ambulances, is taken out of service. We have been experiencing problems with vehicle repairs, with 1 ambulance waiting on repair diagnosis from a manufacturer representative for 3 weeks and 1 ambulance waiting on parts for over a month. We had a routine ambulance failure last week that normally would not have been an issue, except with 2 trucks already out of service. The routine repair dropped our fleet below what we would consider a secure reserve status. And I will just add, we've had similar issues with RTS. I think many of you have heard about the challenge with getting automobiles parts. So we do have problems with that from the RTS side I can speak to. 3, COVID patients. There is almost no shift that goes by now that our EMS crews are not evaluating, treating, and are transporting a COVID patient. Even during the surge of the virus last winter, we were not seeing this number of patients with this diagnosis are presenting with these signs and symptoms. Each of these patient transports requires a significant decontamination and cleaning of our equipment, which along with delays at receiving facilities as they undergo their appropriate isolation processes can cause increased times for ambulances to return to service. That's his final point. He closed with this statement: I wanted to present all of these items to present my concerns that the pre-hospital healthcare system, all the way from the call takers to the transport crews, are as close to a single point of failure as I have ever seen in my career. We have so far been able to maintain our coverage, but there is no expectation of providing any improved services, and we could very easily see increased delays or hindrances to such provision of care. I don't have all the answers, and I don't know that there is one single answer, but any measure that can be reasonably taken to help us maintain the availability and effectiveness of the pre-hospital healthcare system would certainly be supported by our office. That's the end of his statement. again, I share it from the hospital side. I think I've given you a good explanation. We have had heavy influxes. We have implemented our surge plan. It has stressed us at times stretched us as times as far as we've been treating in the hall to make sure we're getting people the care they need. I do worry about the patients with COVID or other critical patients that are in the system that we cannot get to the appropriate level of care because of this. 2 days ago, another hospital system, and I won't say who, and I won't give any specifics that might be able to identify, but a patient was scheduled for a procedure to help manage a severe diagnosis, a terminal diagnosis. They were not able to take care of that procedure because they were so full of COVID. That patient presented in our hospital ER. We managed the pain. We arranged for another surgeon to accept this patient so that they might be able to get the patient the care they needed. That was then taken care of the next day. And I'd like to tell you this is isolated, and I'm not an alarmist, but I will tell you that if we don't do something, I do worry about what we might see as this increases. And it's not just COVID. I want to emphasize that. If one of you are at home and you had a critical illness, the COVID crisis of what we're seeing with the surge in our hospital systems may also keep you from getting the care you need. Now, I have been very committed to supporting this community with vaccination. I think you all know that. I have ramped up efforts again because there is an increased desire. There's also a need right now to give third doses to immunocompromised. We're watching for FDA guidance about third doses for the ones that have gotten their second doses. And when that comes out, I will be right there with the other volunteers to support getting those out. But let me be clear, if you got a first dose of COVID vaccine today, you will not see immunity likely for 5 to 6 weeks. That is not going to help us. There is one thing that will help us, masking. Now, I know that's been controversial, and I know there is discussion about is it effective, and I was asked this by town council members. So I pulled a study that I shared with the town council that was performed by Duke. And I'm just going to summarize it for you. And I don't know if I could put this on the screen, but I will try to be, pretty clear about it. Masking is effective, okay, if you use the correct mask, and it does not require an N95 mask. It's effective because it does two things. Number one, when you have a mask, it stops you from shedding the virus. The virus is for the most part shed on droplets. Droplets are by 0.5 of a micron. It's very small. So I won't get into how big it is or small it is, but it's very small. But that's how it's spread for the most part. So it stops you from spreading it. And if you're wearing one, it also stops you from inhaling it, okay? Now, the study done by Duke, it evaluated multiple masks. And as long as you're not wearing a bandana or a neck gaiter, you are going to have a mask that effectively filters out anything greater than 0.2 to 0.4 microns. I personally wear a level 1 surgical mask, which filters out everything greater than 0.1 microns. So masking does work. Masking does stop the spread of COVID immediately, but only if we're all doing it. So my proposal to the town, our request to the town, is that we would implement a mask mandate based upon the testing prevalence of COVID in the community. I get people don't want to wear it. I've been in healthcare for 35 years. I hate them. I think we all can appreciate what healthcare workers are going through when they have to wear them for a 12-hour shift. However, if you only wear them when you're in indoor settings in the public, when you cannot socially distance, you don't have to wear it all day, but that would stop the spread. I would suggest we look at this on a weekly basis. The CDC does post our testing prevalence rate for each of the counties weekly. We're currently at 18.9% of our testing are positive. They've put us in a high category, or red category, when it's greater than 10%. So we're far in excess of that. And you only have to hear my stories or others around you to appreciate that that's real. So my proposal would be to look at masking when you indoors in public, or when you can't socially distance in public, and that it would be required, and that we would look at it weekly, and when the rate drops below the red category or less than 10%, that you would take it down. So that's my request, and I'm really presenting this on behalf of all the healthcare workers in our county, the hospitals, the EMS, and the health department to help us out during this time, because we want to be able to help you. Thank you.
Thank you, Tom. And I'll now open it up. Would anyone like to ask Tom of any questions? I have one. In places like eating establishments, Tom, of course, we'd have the provision that while people are eating or drinking, there's no requirement.
Yeah, that's right. And I would, you know, I'm not encouraging you to sit there and go back to limiting the capacity in the restaurants.
Right.
You know, I'm not saying that wouldn't help, but I do appreciate how this has also impacted the businesses. And I appreciate how busy the town is. So I'm not proposing that, but I am proposing if you're waiting in line, if you're not at a table eating, that, yeah, you put a mask on.
And we're not talking about any capacity limitations on any facility, actually, just the idea that everyone would be wearing a mask, unless you fall in these categories that you've presented to us.
That's my recommendation. And I recognize we've been going at this for, you know, over a year, and how exhausted people are with this too. So I'm trying to be, I think, you know, whatever the town does, there's a second point that, you know, we talked about, which is people got to follow it. And, you know, I get that, you know, there's not a heavy fine with this or a heavy penalty. I think that the town would stand up and say, we need this and we're expecting this, goes a long way. But I think if it's overly burdensome, I think the compliance is going to drop. So I'm basing it upon that as well. I think what I'm asking is very attainable, very reasonable. You know, when you walk into a public venue, put your mask on. When you walk out and you're not socially distanced, take it off. You know, that is not asking a lot, you know, at least in my mind. And when you're
and let me just say this too. I know some merchants might say, well, you haven't consulted us. I have talked with some merchants, and some of them are really actually would be very supportive of this. But this isn't really a business decision per se. It is a public health and safety decision that we have to make, in my opinion. I don't want to curtail business, and I don't think we are, but we do have an obligation, I think, to do what's best in the interest of the public. So do we need to go over the exceptions or the conditions of?
Yeah, I do. I think I did add those, Pat. I didn't send it to all. I sent it to you and Josh, but I do think.
I think we sent it to everyone.
Okay. Yeah, there are certain things that really they should be exempt from. Children under 2 years of age should be exempt. People with a medical condition, mental health condition, or disabilities that would preclude wearing a mask, such as those for whom a mask could obstruct breathing, who are unconscious or incapacitated, obviously, unable to remove a mask without assistance, people for whom seeing the mouth is essential for communication, hearing impaired, are those communicating with a person who is hearing impaired, are, of course, those who are working in high-risk areas, such as local, state, federal regulators, our workplace safety guidelines. So if there was be some reason that wearing the mask might create another safety hazard, obviously that should be, you know, an exemption.
Okay.
And there may be others that you want to add to those, but you know, those were ones that I saw commonly out there that I think are very reasonable to make sure that we aren't doing something that's unsafe, that restricts somebody that with a disability or creates another hazard.
Okay. I don't know if Chief Holland is on the line. She has had a very hard morning, very difficult morning. Chief, are you with us on this call? Josh, I think you talked with the chief about the way this could be enforced. Would you mind speaking for the chief, what y'all discussed?
She did say, as far as inside commercial buildings, if someone was not wearing their mask and they were asked by the owner or an employee to wear the mask, and they would not put it on, would not leave, that they can be charged with trespass.
Okay.
Mr. Mayor, I have a comment.
Okay.
I I've talked with a couple of the merchants around town, and I agree. I think some of them are in favor of this in some shape, form, or fashion. My concern is, and I think the merchants that I have spoken with would prefer to see I don't want to say an individual, but a business run, so to speak, mass compliance scenario. If you walk in my shop, I've got a sign on the front door that says, please wear a mask or whatever. I don't see any difference as far as, if you're walking down the sidewalk, you're out in the open, you don't have a mask on, you turn to go in a door, and you do have to put a mask on. The 6 inches or the 2 feet away from that door, doesn't matter a hill of beans to me, unless we're going to do it townwide. And I mean townwide, I mean in the business district.
Yeah, that's what I was under the impression. That's what we do.
Sidewalks and everything.
So in the business district. So I mean, obviously, if you're walking down Spring Street, you wouldn't need a mask on. But if you were on Main Street shopping, you would need a mask on.
I think I'd rather see a maybe not forced compliance, but certainly start off with a business, individual business owner kind of help us to raise the compliance level, so to speak, rather than do another town-wide, on the sidewalks, in public kind of thing. Because I think it gets real hard to judge. As we've got these huge crowds that are walking up and down the sidewalk. Essentially, we're going to have to say, if you're on the sidewalks or you're anywhere in the business district, you have to have a mask on. I think to Brian's point, maybe Spring Street, if there aren't 3 or 4 people walking by, but it's kind of hard to control that.
Well, I'm lost, Buzz, on your suggestion about the businesses. Are you saying leave it up to the business whether they require a mask or not?
Yes. Yeah, each individual business owner should have the responsibility. I mean, if they feel that their shop is affected one way or the other, I think it's up to the individual business owner to refuse service, so to speak, to someone that doesn't have a mask on if they choose.
I guess I'm confused. Are you saying that we should implement it outside on the streets and the sidewalks and let the businesses run their own businesses, decide inside?
Yes. If I'm understanding what you're saying, yes.
So the town's going to say anybody in the commercial district outside has to wear a mask if they can't be socially distanced the 6 feet. But inside the businesses, you don't think we should dictate what they have inside the business?
Well, if you get to that point, then maybe Jay ought to step in. I'm not sure that we have the ability to dictate what anybody does inside a business.
Well, but like Mr. Neal said, though, if we're not all doing it at all times, it's not going to be effective. So I have no problem
and
having a
Josh,
mask
maybe
on.
you can weigh in on this. I know Chief Holland felt comfortable about enforcement within a business where owner asks someone that's not wearing a mask to leave, that they have trespassing statutes involved. I don't think the chief was very enthusiastic about attempting to enforce a mask policy outside on the sidewalks, given that the governor has not taken any action whatsoever, on this issue of masking at this time. So that could be, problematic trying to enforce a masking order outside more so than inside.
And that's where I'm coming from, Mr. Mayor. I think, Jenny, why don't you weigh in on whether or not the town has any enforcement ability inside an individual business?
You do. This is a public health and safety issue, and that pretty much trumps most of your civil liberties. If the town decides that it needs to take this step, it can do it. Just because the governor has not issued a new emergency mandate does not mean that the town has been stripped of its ability to govern on this point, which makes a lot of sense because, public health and safety issues are sometimes quite isolated and they don't need to be mandated statewide to become effective. So I think the town, if it wants to reimpose mask wearing as been recommended by Mr. Neal, I think it's okay to do so. I've just spent 3 days in Asheville, and if you go into any place in Asheville, there's a little sign that says wear a mask, and everybody's wearing one.
Mm-hmm.
Now, I don't know. I assume that they passed a law or an ordinance or a resolution of some sort in Asheville to that effect. That's what I gather they've done.
Yeah. I see that Chief Holland is on the meeting now. Chief, would you like to respond to the issue of orders for wearing masks?
No, we'll do whatever what y'all want us to do. Just let me know what that is, and we'll handle it. I missed part of the meeting. I had somebody in my office, so I'll catch up with Josh on what y'all discussed for the last 30 minutes.
Well, we're talking about the issue of ordering an order that requires masks being worn indoors versus an order that would require masks being worn outdoors on the sidewalks. What are your feelings about that?
Well, I think indoors for sure, and outdoors it's a little bit harder to enforce, but indoors is a little bit easier because then it's kind of left up to the store owners to reach out to us, and at that time, if they fail to comply and they ask them to leave the store, then obviously we can charge them with trespassing.
To me, it comes down to we have variants out there that are more transmissible this year than we had last year. We have a healthcare system and a healthcare delivery system, or the pre-healthcare, whatever Warren Cade calls it, that is basically stretched. We have not just COVID patients, but we have other healthcare issues that we are not going to be able to meet. Okay. A more virulent virus than we had last year. Our numbers are up. To me, it is a public health concern that I don't see why we're wishy-washy about saying, you know what, for the good of everybody, we're going to try and make this work. Now, if you don't want to do it, okay, you're going to be singled out and we'll try and make you wear a mask, but we're going to basically say you need to wear a mask. That's a logical thing to say, that we're in this situation. We can't be wishy-washy and saying, oh, well, civil liberties. This is a public health decision here. And that's exactly what it is. And Jay's just told us we have the ability to do that on a local level, not wait for the state. And I truly believe that we're not going to get through this if we don't start doing some of these things.
Amy, I agree with you 100%. I think my point is that we don't just mandate inside buildings, because we got 4 people walking abreast down the sidewalk. The fact that they turn and go into a building makes absolutely no difference whatsoever. I think if we're going to do this, it needs to be not town-wide, but business district-wide, in public, in businesses. The people on the sidewalks need to be masked. The people in businesses need to be masked. It's, you know, to do it only having the distance of a door between you and masking and unmasking into a business makes absolutely no sense to me.
If we're gonna get a handle on this, it needs to be done outside too. I agree with you, Buzz.
I agree.
Yeah.
If I could clarify, my proposal was that it would be in outdoor settings when socially, you cannot social distance. And Pat had asked me this at one point earlier, and I said, walk down the street, you want to tell me I don't know how you social distance with the number of people in this town in the business district, but
Yeah.
I'll defer to the town. I think that what I proposed covered that, but I get your point, Buzz. I mean, you're spot on with your assessment of the crowding there. It has to be outside if you're not, keeping 6 feet apart. I don't know how you do it on the business district.
Yeah, I don't either.
I will add that I talked to Cynthia Strain about the art show this weekend. They were already planning on doing all of the protocols, even though that's an outdoor venue, wearing masks and the distancing and so forth.
Well, can we go with the same, we had all this sorted out last year when we went to mandate masks. So we had did we not have a map basically that said if you're in, I don't know if it was B1 or whatever, Main Street and North 4th Street, all of those areas would be good. Basically where you have high density of people walking around shopping, that would all be required to wear masks. Can we not just go back to that?
We had, I think, Commissioner Steeler, it was any business zone.
Okay.
Any business zone was the way that was worded.
Well, we also had a stipulation, obviously, if you were running, if you're out for a jog and you went down Spring Street, you did not need a mask on, so.
Correct. Not in neighborhoods.
Yeah.
What about government buildings?
We already have that in place
Okay.
with the August 2nd resolution. We require that in buildings. And by the way, I'm in town hall today. I've got my mask, but I'm the only person here.
So do you need a motion?
I do.
I'll make the motion that the town of Highlands is requiring masks in the commercial district and within the commercial businesses until the CDC testing numbers, what is it, Tom? The CDC testing numbers, positivity rate goes below 10%.
Correct.
Okay. Would you also add the conditions that Tom stipulated?
Yeah, except for the reasonable conditions that are pretty well known about children, health issues, those kinds of things.
Mm-hmm. Okay.
I'll second that motion.
Okay, got a second. Do we have any further discussion? Commissioner Haynes, we haven't heard from you.
Well, we got a good CEO. We got to give him the tools he needs to do the job. I do want to ask a question after the vote on this subject.
You don't think it's pertinent?
Well, it's
prior to the vote?
it's about signage. We,
okay.
we provided signs last time with the town logo and gave them all the businesses, and we need to visit that after the vote, please, sir.
Okay.
Call for the vote, Mr. Mayor.
Okay. Hearing no other discussion, let me do this by the proper Zoom protocol. I will ask each commissioner their vote. Commissioner Patterson, how do you vote on this issue?
Aye.
Aye, okay. Commissioner Dotson, how do you vote?
Aye.
Aye. Commissioner Steeler?
Aye.
Okay. And Commissioner Haynes?
Aye.
All right. That motion passes, and we will institute the mask requirement. When would this begin? Effective immediately or at some other point in time?
Immediately.
Yeah, I would say get it going as soon as you can.
Okay. All right. Chief Holland, we would have to change that signage.
Yes.
And
Mis-
then
mis-
Commissioner Haynes.
Well, go ahead. I didn't mean to interrupt. Go ahead.
Well, we'll need to change those sandwich board signs to reflect this. And then we will need to also address this issue that you've brought up about what kind of signs need to go up, or what's the pleasure of the board on that?
Well, you know, we made some over a year ago and we printed them and gave them to the businesses and they all willingly put them up. And
Yeah.
Yeah, we need to figure out how we're going to, before the weekend, which is tomorrow, tell all the businesses that this has occurred so that they can at least be letting all their patrons know that they do need to mask. I don't know how you want to do that, but we need to let people know, not just the folks that are on the call today, that it is a requirement now. If we're going to get a handle on it, we need to start right away.
Yeah, the chamber can certainly get the word out in short order, I would think.
I do believe that the chamber's on this call.
Hey, Mr. Mayor, if I could, Dr. Wheeler is on. She has her hand up. The
Okay.
LAQ 6490. I don't know if you want to hear her comments, but I will.
Sure. Be happy to. Dr. Wheeler? I think she might be muted.
I just wanted to be sure that people understood that with the COVID vaccines, we can still give others the virus. So even though some of us may feel we're protected, we still can share virus particles with folks who are less healthy or not protected at all, one. Two, the whole point of being outside is that the ventilation may be a bit better, but certainly the groups of people that you see walking up and down Main Street is definitely a concern. So I do appreciate you doing this. It's a great move, I believe, in the right direction.
That makes a good point, Dr. Wheeler, because I've had many people tell me I don't need to mask because I've been vaccinated. Now I require them to mask anyway, but it is something that we need to make sure if we're going to put signs in there, we do not say vaccination eliminates your need to be masked. However we want to do that, but that is something that is a point that a lot of people maybe have a misunderstanding of.
Okay. Seems to me that here on a Friday afternoon, we have kind of a difficult situation with getting this word out before the weekend completely. I kind of suspect this is going to be a phased in process over the next day or two, at least.
Better late than never.
Right. We can change the signs on the sandwich board, Chief Holland, very quickly. Getting those other signs out might take a few days, and getting the message to the merchants might take some time also.
Correct me, this is the outside on the sidewalks in the business district and inside, correct?
Correct.
Chief, do you have the manpower to put somebody on the sidewalk going to each individual business this afternoon and just sticking their head in and letting them know this is what's been done? Whether, you know, so that way, if a business is not a member of the chamber and they don't get the chamber notice, then hopefully everybody would know.
I'll do it myself. I'll go do it.
Okay.
I've got 2 officers, and with the morning I've had this morning, I don't know what's gonna happen up here.
I'll help you out.
I'll go do it.
We appreciate that, Chief. We know
Thanks,
you've had an incredibly hard day today.
I am filthy dirty, and I realized that I need to hit the gym after about a 3-minute struggle with a man on something preparing.
Well, we appreciate it. And Buzz, I think that's a good suggestion. If we just go door to door with the businesses as much as possible, I will go on the radio station right now and make an announcement as soon as we adjourn. And then we need to, Commissioner Haynes' suggestion about signage. As we go into the next week, I think that is something that needs to be addressed. Josh, could you kind of work with coming up with a plan to for us to create some signs for placement in the business district?
Yes, we can do that.
Okay, all right. What are we missing? What do we need to cover?
I move to adjourn.
Okay, before I adjourn, I want to express my appreciation to Tom Neal. I know we're putting on another vaccination clinic tomorrow morning, but I appreciate his candor and leadership, and also Warren Cade for his feedback that he's also given us. And I think we're doing the right thing. Although it's again will be difficult, it's important and necessary. So Commissioner Patterson, you have a motion to adjourn.
Second.
Second. All in favor, let me go through. Commissioner Patterson, what's your vote? Okay, Commissioner Dotson,
Aye.
Commissioner Steeler,
Aye.
and Commissioner Haynes.
Hi, have a good weekend.
All right, we are adjourned.
Hey.
Thank you very much.